Oregon and Washington, among some West Coast states, standing firm that all children still need certain vaccines like flu and RSV shots, despite the federal guidelines that are changing this week. Today, we wanted to know more about whether insurance will still cover those shots and where should parents get more answers. Our Lisa Balick spoke with the former head of the National Academy of Pediatrics, an OHSU doctor. And Lisa joins us live now from South Portland. Lisa?
Yeah, I also talked with some state leaders as well in the healthcare area. And we got answers today to clear up some of the vaccine confusion and found out where you can go as well if you've got questions to clear up confusion that you may have on this.
It's going to make things harder for families. It's going to make things harder for pediatricians. And it's ultimately going to lead to increased harm to kids through illness.
OHSU Dr. Ben Hoffman is the former president of the American Academy of Pediatrics, a national association of more than 60,000 doctors who care for kids. The AP is not changing its vaccine guidelines, despite the federal government taking 6 vaccines off the universally recommended list: RSV, flu, COVID, hepatitis A and B, rotavirus, and meningococcal. Hoffman understands parents have a lot of questions now, especially when the shots have prevented these illnesses in the past, like rotavirus,
which is a virus that causes horrible vomiting and diarrhea, dehydration in kids, especially babies, was responsible for tens of thousands, if not hundreds of thousands of hospital admissions a year that essentially stopped. We fixed it. We're going to see those things coming back.
Some parents worry insurance may not cover some of these shots taken off the list, but the federal government says they are still covered by insurance, at least for now. We heard from state health leaders on this as well.
As of December 31st, 2025, all recommended child and adolescent vaccines remain available and continue to be covered by public and private insurers, meaning those recommendations that were in place by the federal government at the end of last year. And this covers all of the AAP recommended vaccines.
The message is trust your pediatrician when it comes to getting vaccine advice.
There is no universe in which I would ever recommend something to a parent or caregiver that I and my wife, who's also a pediatrician, would not recommend or do for our own children. And I think that that's a really powerful thing.
Now, another big question people have is what's going to happen with school? For example, there are certain shots kids are required to have to be able to go into the public school system. Right now, no change whatsoever. There may be changes down the road, but for now, everything is just status quo here in Oregon and Washington. Back to you.